So good day, my name is Cesar Ramos from BSN2-2, and today I will be presenting my drug literature about my chosen drug, which is metformin. So this is our table of content. So metformin. Metformin helps to control the amount of glucose or sugar in your blood. It is used in patients with type 2 diabetes. So controlling high blood sugar helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. So proper control of diabetes may also lessen your risk of a heart attack or stroke. As for the formulation, each sachet contains metformin 500 milligrams. And for the description, it is white to off-white colored and round in shape. Now, let's proceed to the pharmacodynamic properties. So, metformin is a biguanide antihyperglycemic agent which improves glucose tolerance by lowering both basal and postprandial plasma glucose. It exerts effect by decreasing hepatic glucose production through inhibition of gluconeogenesis and glucogenolysis. So, delaying intestinal absorption of glucose and improving insulin sensitivity may increase peripheral glucose uptake and utilization. Onset is within days. So, as for the pharmacokinetics, the absorption is slowly and incompletely absorbed from the gastrointestinal tract. Food slightly delays and decreases the extent of absorption. Absolute bioavailability 50 to 60%. Time to peak plasma concentration 2 to 3 hours. Immediate release 7 hours. Range 4 to 8 hours extended release. As for the distribution, concentrates in liver, kidney, gastrointestinal tract, and salivary gland tissue, crosses the placenta, and enters breast milk, small amounts. Volume of distribution 654 and 358 liter. As for the metabolism, it is not metabolized. And for the excretion, via urine, approximately 90% as unchanged drug. Elimination, half-life 4 to 9 hours. Plasma, approximately 17.6 hours blood. So for indications and dosage, it is oral and type 2 diabetes mellitus. As for the adult, as an adjunct to diet and exercise, treatment is monotherapy or in combination with other anti-diabetic agents or with insulin. As conventional or tub solution, initially 100 to 850 mg, 1 to 3 times a day, gradually increase at intervals of at least 1 week, or alternatively 10 to 15 days according to patient's response. Max is 2,550 to 3,000 mg daily in 3 divided doses. As extended release, initially 500 to 1000 mg once daily. Increase at intervals of at least 1 week, or alternatively 15 to 10 to 15 days. Max is 1500 to 2000 mg daily. Prophylaxis to reduce the risk of or delay the onset of type 2 diabetes mellitus in high-risk individuals. As extended release tab, initially 500 mg once daily, gradually increase at intervals of 10 to 15 days according to patient's response. So max is 1500 to 2000 mg daily. Dosage recommendations vary among countries or individual products refer to country or product specific guidelines. So as for the child, 10 years above, as monotherapy or in combination with insulin, as conventional or tub solution, initially 500 mg once daily or twice a day, or 850 mg once daily, gradually increased at intervals of at least 1 week, or alternatively, 10 to 15 days according to patient's response. Max is 2000 mg daily in 2 or 3 divided doses. Dosage recommendations may vary among countries or individual products. Refer to country or product specific guidelines. So as for the contraindications, acute or chronic metabolic acidosis, including diabetic ketoacidosis with or without coma, diabetic pre-coma, acute conditions which may alter renal function, acute or chronic conditions which may cause hypoxia, and also acute alcohol intoxication or alcoholism, hepatic or severe renal impairment, concomitant intravascular administration of iodinated contrast agents. As for the side effects, it is significant vitamin B12 deficiency, prolonged use, gastrointestinal disorders, nausea, vomiting, abdominal pain or distress, flatulence, diarrhea, dyspepsia, taste disturbance, metabolism and nutrition disorders, loss of appetite, musculoskeletal and connective tissue disorders, asthenia, and the potentially fetal is the lactic acidosis. Next is the interactions. For drug interaction, it is increase of lactic acidosis with carbonic anhydrase inhibitors, NSAIDs, including cyclooxygenase or COX, 2 inhibitors, ACE inhibitors, angiotensin 2 receptor antagonist, and loop diuretics increase the risk of hypoglycemia with other anti-diabetic agents, increase plasma concentration with organic cation transporters in 2 inhibitors, reduce efficiency or efficacy with OCT1 inhibitors, increase gastrointestinal absorption and efficacy with OCT1 inducers. We produce hypoglycemia with corticosteroids, thiazide, diuretics, phenothiazine, thyroid products, estrogens, and oral contraceptives, phenytoin, nicotinic acid, and sympathomimetics, channel blockers, and isoniazid may diminish the therapeutic effect of anticoagulants, potentially fatal, contrast-induced nephropathy, and increased risk of lactic acidosis with concomitant use of intravascular iodinated contrast agents. As for the food interaction, food slightly delays and decreases the extent of absorption of metformin, increased risk of lactic acidosis with alcohol. As for the administration, it should be taken with food, exert, swallow whole, do not spit, crush, or chew. As for the nursing considerations, as per the assessment, do not discontinue this medication without consulting your healthcare provider. Monitor urine or blood for glucose and ketones as prescribed. Swallow extended release tablets whole. Again, do not cut, crush, or chew. Do not use this drug during pregnancy. If you become pregnant, consult with your healthcare provider for appropriate therapy. Avoid using alcohol while taking this drug. Report fever, sore throat, unusual bleeding or bruising, rash, dark urine, light-colored stools, hypo or hypoglycemic reactions. As for detection points, history, allergy, To metformin, diabetes complicated by fever, severe infections, severe trauma, major surgery, ketosis, acidosis, coma, type 1 diabetes, serious hepatic or renal impairment, uremia, thyroid or endocrine impairment, glycosuria, hyperglycemia associated with primary renal disease, CHF, pregnancy lactation, physical, skin color lesions, deorientation, reflexes, peripheral sensation, or adventitious sounds, liver evaluation, bowel sounds, urinalysis, BUN, serum, creatinine, LFTs, blood glucose, CBC interventions. As for the touching points, monitor urine or serum glucose levels frequently to determine effectiveness of drug and dosage. Warning, arrange for transfer to insulin therapy using periods of high stress, infection, surgery, and traumas. Again, warning, use IV glucose if severe hypoglycemia occurs as a result of overdose. Now let's proceed for the current research. Through investigating with clinical studies, researchers concluded that in addition to decreasing cardiovascular events and anti-obesity, metformin is also beneficial for neurodegenerative disease, um, polycystic ovary syndrome, aging, cancer, and COVID-19. However, it is also induces some adverse effects such as gastrointestinal complaints, lactic acidosis, vitamin B12 deficiency, neurodegenerative disease, and upstream impairment. Of note, the dose of metformin used in most studies is much higher than its clinically relevant dose, which may cast doubt on the actual effects of metformin on this disease in the clinic. This review summarizes the research developments on the mechanism of action and clinical evidence of metformin and discusses its therapeutic potential and clinical safety. So those who receive in a new study published in the Lancet Infectious Diseases, Jambius MD, PhD, University of Minnesota, researchers and colleges found that metformin, a drug commonly used to treat diabetes, prevents the development of long COVID. So the study found those who received metformin were more than 40% less likely to develop long COVID than those who received an identical looking placebo for participants who started metformin less than 4 days after their COVID symptoms started. So metformin decreased the risk of long COVID by 63%. As for the evidence-based practice guidelines, the analysis demonstrated a significant reduction in the risk of diabetes among individuals receiving metformin medication interventions as indicated by the risk ratio of 0.58. These findings suggest that individuals receiving metformin had a 40% lower risk of developing diabetes compared to those in the control group. So collectively, these findings from various studies provide robust evidence supporting the effectiveness of metformin in preventing the onset of diabetes, particularly in high-risk individuals. The results highlight the potential of metformin as a valuable preventive intervention in the global efforts to combat the growing burden of diabetes. So the best evidence um, for a potential role of metformin in the prevention of type 2 diabetes comes from the Diabetes Prevention Program or the DPP trial. So lifestyle intervention and metformin reduce diabetes incidence by 58% and 31% respectively when compared with placebo. That concludes my presentation with drug literature. These are my references. Thank you for listening.